Hi, I'm Astrid, the medical esthetician at Lake Nona Ophthalmology Med Spa. One of my most commonly asked questions is, what is the difference between a chemical peel and a facial? A facial is a deep cleaning treatment that lasts about an hour. During that hour, we exfoliate your skin, we perform extractions of blackheads, oil, dirt, and debris from the pores, and then we replenish your skin with hydrators and facial masks that are going to help repair the barrier. And then we finish off with sunscreen. After a facial, your skin is going to be nice and glowy, maybe a little red because of extractions, but there is no downtime associated with a facial treatment. A chemical peel is when we use an acid and apply that to the skin to increase the shedding process. Chemical peels improve the texture and can improve pigmentation, acne, and minimize fine lines on the skin, but it does come with some downtime. Some of the things you'll experience after a chemical peel is a little bit of redness, a little bit of flakiness or peeling, and sometimes discomfort depending on how aggressive the peel is. Chemical peels can cause purging or breakouts after the treatment if your skin hasn't properly been cleansed beforehand. So I highly recommend getting a facial done a week to 2 weeks prior to your chemical peel for the best results.